Now, South Africa's power woes are continuing. Eskom is currently implementing stage 6 rolling blackouts until further notice. The utility says this is due to generating unit failures at Tutuka, Kriel, Duvha as well as Kendal power stations on Thursday. So how are hospitals coping and what progress has been made with installing solar panels at health facilities? We're joined now by the health spokesperson, Mohale. Foster, thank you very much for your time here on All Angles. Now, I remember there was a discussion between Eskom as well as yourselves as the National Health Department about exempting some of the important hospitals in South Africa from load shedding. There was an agreement there, but there was also an agreement that there would be solar panels put on the roofs of public hospitals. How far is that?
Good afternoon, Maxeke, and good afternoon to your viewers at home, and thanks for this opportunity on behalf of the Department of Health. Yes, just to give you an update as far as we've gone as the Department of Health with regards to ensuring that our health facilities, they are not inconvenienced by power load shedding. As we've announced that we've embarked on a parallel processes as part of energy mix. With regards to exemption, yes, we are still sitting at 76 hospitals across the country, but the discussions are ongoing between the department, Eskom, COCTA and municipalities in order to ensure that we fast-track the exemption of health facilities. With regards to the issue of solar panels, as we've announced that we've been working closely with the CSIR where they embarked on feasibility study on solar panels. We can announce that they've presented the findings report on the feasibility study on the solar panels, and as the department, we are currently going through the findings and the recommendations in order to decide which of low to middle and long-term implementation plans can we embark on in order to ensure that our hospitals continue to have enough power supply. So we'll be able to make an announcement in due course as far as the implementation of solar panels is concerned.
Now, Foster, are you able to tell us at all in terms of how much the department or different hospitals have managed to save after being exempted, especially these 76 hospitals? I know you did express that that's not enough because of the lives that you save at some of these hospitals. But how much have you been able to save in terms of the diesel that would ordinarily have to be used for the generators?
Yeah, unfortunately, I don't have the figures and the rands and the cents as far as the savings we've made with those facilities that have been exempted, precisely because there are very few as compared to the target number of hospitals that we wanted to exempt. As we remember that our priority list consisted of 213 hospitals across the country, and out of that number, we managed to exempt only 76 hospitals. So what we can confirms that we have spent a lot on generators, fuel maintenance, more than what we have planned in the past financial year. That the figure that most people they keep on saying, the figure that about 700 to 900 million rands went into a drain. But as the department, we have got we beg to differ with them. We say as much as we have saved, we have spent a lot of money, but we are happy that no life has been lost during the power load shedding. So we are happy with the progress that we've made. Of course, we need to ensure that we fast track the implementation of load shedding in order to save more funds.
All right. So just tell me something, Foster, in terms of, okay, you're saying that obviously you would have saved, etc. And you're in talks now in terms of the solar panels that have to go on the roofs of hospitals. But we've spoken to experts, for instance, on channel, other media, who also say that there is now a growing syndicate because of the demand of solar panels. There are people who are out there to steal solar panels, to start reselling them to new customers. So have you spoken about security at hospitals as well to ensure that, these kinds of people don't get access to these panels?
Definitely, as part of hence we are delaying the process of announcing on how we are going to go about implementing the solar panels to be installed at our health facilities, because of course security and also maintenance are very important, because we don't want to rush to implement something which is not going to be sustainable for tourism. It's very costly, and we don't have a sustainability plan. Number two, the issue of security, of course, is very important. As we know that there's a high crime rate. Obviously, people are the criminals. They see an opportunity in those solar panels. So we need to ensure that where we are going to install the solar panels, we also increase security to ensure that all this infrastructure is secured.
All right. So, Foster, in terms of the hospitals and what has been happening currently, I know that you might not have really been privy to a lot of information because it was the Gauteng Health Department that announced this. Steve Biko hospitals and some of its feeding hospitals have had trouble this week. Their boilers basically collapsed, and the hospital had some functions of it not working, even to its feeding hospitals as well. Have you gotten an update, or have you spoken to the Gauteng Health Department as National Health about when, or if already, the units are back online?
Yeah, we communicate with them. In fact, the Gauteng is more convenient because national we are in Gauteng, so we communicate with them on a daily basis. Just this morning, they made an announcement after there was misinformation about evacuation at Maxeke, which was not entirely correct, but it was just a minor explosion of a microwave in one of the kitchens in the hospital. So we constantly communicate with Gauteng, but also with all our counterparts in the hospitals. So with regards to the issue of Steve Biko, yes, we are aware of the situation, and the good things that once there's this kind of challenge, we work together, we sit together, we bring our minds together in order to find a solution to ensure that our nearby facilities, our patients are not inconvenienced for a longer time. Of course, it's very inconveniencing, but as soon as we come across all these challenges, we ensure that we assist them to come up with the intervention plan to ensure that we continue to render the service.
And just lastly, Foster, Eskom has been warning us for some time now. Even the new electricity minister telling us just 2 or 3 weeks ago that he doesn't rule out the possibility of higher stages of load shedding, especially during the winter months. Will you be ready as the health department? Your job is a very crucial one in terms of saving lives.
No, definitely, we are more than ready. Then we are not shy to say we have spent millions of rands in the past financial year on fueling and maintaining the generators. That's why the provinces like Limpopo, the MEC of Limpopo, Dr. Popira Matua, did announce that they procured generators for all the health facilities in the province in order to prepare for what the Eskom and the Minister of Electricity has announced. So the same is applicable to other provinces to say, please, let's be ready. Let's put all our ducks on a row. Let's make sure that all our generators are well maintained, well fueled at all times to ensure that when we are hit by higher stages beyond stage 6 or stage 6, at least we're able to continue to provide health services with less disruptions so that our people will continue to receive essential health services in our health facilities.
Foster, I'm going to get into trouble with Zama Zungu for this, and I know she's really going to shout at me, but I have to ask you this question before I let you go. Are you in any capacity to give us an update on Maxeke? The Health Department, National Health Department, took over that project after the Gauteng Health Department could not. At some point, there was a promise last year around April that in December work should be completed. It is now almost May.
Yeah, as if you prophesied that earlier this morning we had a meeting with the provincial health department, the Premier's office, and other stakeholders who are involved in the refurbishing of the Maxeke Hospital. Will be able to officially announce, led by the Minister of Health, Dr. Joe Patla, together with the Premier of Gauteng and the Minister of Health, on the progress, the good progress that we've made as far as
5 months
refurbishing
late.
the hospital. Yeah, whether, of course, but remember, we at least we're very honest and transparent throughout with the challenges that we encountered along the way, but we also ensure that all the people who depended on or the patients who dependent on the Charlotte Maxeke Hospital, they continue to be diverted to other areas. So we ensure that we provided more support, sufficient support and resources in other hospitals to ensure that they're able to assist all those who depended on this particular health facility.
All right. Foster Mohale, the spokesperson of National Health, thank you very much for your time.